In this video, we're going to talk about what agencies are covered. Well, the Fair Labor Standards Act actually puts in specific criteria that have to be met in order for you to fall under the purview of the Fair Labor Standards Act and the protections there within. So there are two legs of this. You can either qualify under one or both. So the very first one is, of course, the amount of gross sales. Now, gross sales could also be construed as the gross revenue that has been obtained. So you're a home health care agency, you are charging patients and you're billing Medicare for the visits that you're doing to take care of the patients out in the field at their home. Well, if you make $500,000, at least that much or greater, then of course you would fall under the purview of the Fair Labor Standards Act, and you have to, of course, follow all these rules and regulations to the T. Now, if for any reason you're a small home health care agency, which is very rare, but if you make under 500,000 in gross sales, then you look at this next criteria, which is called interstate commerce. So interstate commerce basically means that your company is handling goods or transactions for interstate commerce. A perfect example is credit card transactions. Maybe you're calling or emailing or mailing correspondence across state lines. Literally, you could just be going over doing wire transactions to collect money from Medicare, or of course, sending money to people across state lines using these types of items, like using online correspondence for calling. You're sending emails to people who are in different states. Again, if you're doing this, that means you fall under interstate commerce and have to fall under the purview of the Fair Labor Standards Act. Now, it's very possible that you're going to fall under at least one of these, but in some cases, you could fall under two.